Good day, dear colleagues. My name is Vladimir Nazarov, and let me present to your attention a lecture dedicated to the carrier screening of common hereditary diseases using the MonogenScreen kit. First, let me remind you that genetic diseases are conditions associated with the changes in DNA sequence at the various levels of genome organization, from the gene to the chromosomes. Despite the apparent rarity of some individual genetic diseases, their overall prevalence in newborns is from 1 to 5%. Depending on the type of inheritance, several types of hereditary diseases are distinguished. In autosomal dominant diseases, a mutation in at least one chromosome, either from the father or from the mother, is sufficient for the development of the disease. In X-linked disorders, the genes in which mutations lead to the disease are located on the sex chromosomes, and the development of diseases is associated with the person's biological sex. It is believed that the prevalence of diseases from both the first and second group is approximately 2 cases per 1,000 people. In autosomal recessive conditions, which will be discussed today, the development of the disease requires the appearance of mutations on both chromosomes. At the same time, mutation carriers, persons with a mutation on only one chromosome, do not develop the disease. Because of this phenomena, autosomal recessive diseases are potentially preventable conditions. It is believed that every person is a carrier of mutation of some autosomal recessive disease. Autosomal recessive diseases with frequency more than 1/50 is considered to be high carrier frequency disorders, from 1/50 to 1/200 medium carrier frequency, 1/200 and less rare carrier frequency. A population study of the prevalence of mutation in apparently healthy donors in Russian population showed that the most frequently detected abnormalities are heterozygous mutations in the SFTR, PAH, and GJB2 genes. Mutation in the GALT gene were detected less frequently. Let's briefly discuss the conditions associated with the mutations in the SFTR, PAH, GJB2, and GALT genes. Let's start with the SFTR gene. Mutations in the SFTR gene are associated with the following conditions: cystic fibrosis, pancreatitis, and isolated obstructive azoospermia. More than 2,000 mutations have been described in the SFTR gene, but mostly these are region-specific. In the Russian Federation, the most common mutation is the F508del. The prevalence of other common mutations in Russia is presented on the slide. Mutation types include deletions, insertions, point mutations, and even multiple exon deletions. It is important to note that there is association between the type of the mutation and the clinical manifestations of disorders associated with SFTR gene. Let's take a quick look at the conditions associated with the SFTR gene. The most well-known disease associated with SFTR gene is cystic fibrosis. The pathogenesis of this disease is characterized by the disruption of chloride channels, which are encoded by the SFTR gene. Mutation in SFTR gene lead to a violation of synthesis of secretion by the exocrine glands. In cystic fibrosis, a disruption of the work of the exocrine glands of the lungs leads to the development of recurrent pneumonia, bronchitis, the appearance of bronchiectasis, and pulmonary insufficiency. The prevalence of this disease among the population is 1 case per 3,000 people. Another possible manifestation of a mutation in the SFTR gene is a hereditary pancreatitis. This condition is the most common extrapulmonary manifestation of cystic fibrosis. Moreover, up to 48% of patients with chronic pancreatitis are carriers of aberrations in the SFTR gene, and the heterozygous mutations in the SFTR gene increases the risk of developing pancreatitis by 11 times. The development of inflammation of the pancreatic tissue is associated with the deposition of plaques of mucoproteins in the lumen of the ducts and decrease in acidity and activation of trypsinogen. Another important SFTR-associated condition is a congenital bilateral absence of the vas deferens, which develops in men. The prevalence of this disease in the general population is 1 case per 1,000 people, but in the group of men with infertility, the prevalence rises up to 5%. It is important to know that this disease is characterized by the specific set of mutations in the SFTR gene. R117H point mutation, and variation in the number of nucleotide repeats. Another common autosomal recessive disorder is GJB2 related hearing loss. Sensorineural hearing loss is a form of hearing loss that can affect the auditory system from the sensory apparatus of the cochlea to the nerves. Genetic, non-syndromic autosomal recessive hearing loss is the most common subtype of the disease. To date, it is believed that changes in more than 100 genes are associated with the development of sensorineural hearing loss. However, the most common mutations are in the GJB2 gene. In most cases, mutation in the GJB2 gene cause an autosomal recessive form of disorder, DFNB1. However, autosomal dominant forms of hearing loss, DFNA3, can rarely occur when at least one mutation is sufficient to develop the disease. In the Russian Federation, mutation presented on the slide occur in 95% of cases, and it believed that up to 5% of the population may be carriers of these mutations. Mutations in the GJB2 gene lead to disruption of the encoded protein connexin 26, which is involved in the propagation of electrical signal, the exchange of the metabolites and signaling molecules in the inner ear. Disruption of this protein lead to excessive accumulation of potassium in extracellular space of the hair cells and their gradual degeneration as a result of potassium toxicity. Phenylketonuria and galactosemia belong to the group of metabolic diseases. Phenylketonuria is the most common cause of hyperphenylalaninemia, with a population prevalence of 1 in 7,000. The disease is associated with impaired function of phenylalanine hydroxylase, encoded by the PAH gene, which causes a toxic increase in the level of phenylalanine. In turn, galactosemia is a group of the diseases associated with the violation of metabolism of galactose in the body. Mutation in the GAL gene causes the most common form of the disease, type 1 galactosemia, which is associated with the increase in the concentration of galactose and the accumulation of toxic metabolites, galactothiol and D-galactonate. More than 1,000 PAH gene variants have been described, but the most common aberration in Russian Federation is R408W. More than 300 mutations in the GAL gene have been described for type 1 galactosemia, but the Q188R mutation is the most common. Clinically, phenylketonuria is manifested by pronounced development delay due to organic damage to neuronal structure, as well as microcephaly, convulsions, and impaired skin pigmentation. Galactosemia, in turn, is characterized by severe development delay, as well as liver damage, immunodeficiency, cataract, and other neurological disorders. Given that described diseases develop when mutations are transmitted from two carriers, one of the ways to prevent their development is so-called preconception screen, which is a set of measures to identify the carrier state of a common autosomal recessive diseases when planning pregnancy. Identification of the carrier status of mutations in the same gene in both partners can help reduce the risk of having children with genetic disorder. For a long time, there were no exact indications for tests that detect mutations of frequent autosomal recessive disorders. But recently, a number of scientific and clinical associations have issued recommendations for preconception screen. This screen may be offered to all women planning a pregnancy. It is important to include in screening diseases with high carrier frequency. DNA technology had developed the MonogenScreen test, which allows to detect a wide range of mutations in the SFTR, PAH, GJB2, GAL genes. The indication for the MonogenScreen test is the planning of pregnancy and the presence of a family history of cystic fibrosis, phenylketonuria, hearing loss, galactosemia in the patient. This test also confirms the clinical diagnosis of cystic fibrosis, phenylketonuria, hearing loss, or galactosemia if these conditions are suspected or if neonatal screening is positive. The kit is featured by simultaneous identification of 30 pathogenic variants in gene associated with the most common autosomal recessive diseases. Whole blood in EDTA tube or dry blood spots can be used as test specimen. The slide shows a brief algorithm for laboratory analysis of samples using the MonogenScreen kit. isolation and purification of DNA is carried out from the venous blood or dried blood spot using prober GS genetics and prober CTFR respectively. After DNA purification, mutations are studied using the PCR-based kit on the DT thermal cycle. The software automatically evaluates the results and prepares a detailed report. At the end of this lecture, I would like to give a clinical example that confirms the significance of preconceptional screening. A 34-year-old woman is having a pregnancy planning consultation. In the family history, the obstetrician gynecologist found a case of hearing loss on the paternal side. After the testing, the carrier state of the pathogenic variant of the GJB2 gene was detected. After additional studies, this variant was also found in the patient's partner. Having offered various options to reduce the risk of having a child with neurosensory hearing loss, the couple turned to the reproduction clinic. The pregnancy ended with the birth of a healthy baby. Colleagues, thank you very much for your attention.